Side effects of melatonin. What are the risks? Melatonin is a hormone and dietary supplement commonly used as a sleep aid. Although it has an outstanding safety profile, melatonin's growing popularity has raised some concerns. Due to the lack of reliable research regarding its long-term effects, there are concerns about its use as a hormone. This video reviews the potential side effects of melatonin supplements. What is melatonin? Melatonin is a neurohormone produced by the pineal glands in your brain, namely at night. It prepares your body for sleep and is sometimes called the hormone of sleep or hormone of darkness. Many people use melatonin supplements as a sleep aid. It can help them fall asleep and improve their sleep quality. However, it does not appear to be as effective as other sleep medications. Aside from improving your sleep quality, melatonin also helps your body function properly. It can regulate various body functions such as temperature, blood pressure, and cortisol levels. In the US, melatonin is available over the counter. Melatonin is also now available in Australia for people over 55. In most European countries, melatonin is only approved for use by older adults with sleep disorders. Its use is growing, raising concerns about its possible side effects. Does melatonin have any side effects? Although there have been some studies looking into the safety of melatonin, they did not find any serious side effects. Some medical practitioners believe that taking melatonin could reduce the body's natural production of melatonin. However, short-term studies have refuted this idea. Some studies also reported symptoms such as headache and agitation. These were not attributed to melatonin. However, they were common in the placebo and treatment groups. Although it is generally considered safe to take melatonin supplements in short term, more research is needed on its long-term effects. Use in children. Parents sometimes give melatonin supplements to children who have trouble falling asleep. However, the Food and Drug Administration has neither approved its use nor evaluated its safety in children. In Europe, melatonin supplements are a prescription-only medicine intended for adults. However, one Norwegian study found that their unapproved use in children was on the rise. While there is no specific cause for concern, many experts are reluctant to recommend this supplement for children. This reluctance stems in part from its wide-ranging effects, which are not completely understood. Children are also considered a sensitive group, as they are still growing and developing. Long-term studies are needed before melatonin can be used with absolute safety in children. Daytime sleepiness. As a sleep aid, melatonin supplements should be taken in the evening. Taking melatonin at other times of the day can also cause sleepiness. It is important to note that this is not a side effect, but rather the function of the drug. Although sleepiness can be caused by taking melatonin supplements, it is also possible for people with a reduced clearance rate to experience this issue. This is because an impaired clearance rate can extend the time that melatonin levels stay high. In children and older adults, taking melatonin at other times of the day can also cause a reduction in the body's melatonin clearance. This is not known if this effect has a negative effect on the levels of melatonin the morning after taking the supplement. Even when taking melatonin supplements at the same time, it does not affect one's ability to focus. Studies in healthy people injected with 10 or 100 milligrams of melatonin or given 5 milligrams by mouth found no effects on reaction times, attention, concentration, or driving performance compared with a placebo. More studies are needed to determine the effects of melatonin on daytime sleepiness. Other concerns. Several other concerns have been raised, but most have not been thoroughly researched. Interaction with sleeping pills. One study found that taking the sleep medication zolpidem along with melatonin worsened zolpidem's adverse effects on memory and muscle performance. Decreased body temperature. Melatonin causes a slight drop in body temperature. While this is generally not a problem, it could make a difference for people who have difficulty keeping warm. Blood thinning. Melatonin may also reduce blood coagulation. As a result, you should speak with your doctor before taking high doses of it if you also take warfarin or other blood thinners. How to supplement with melatonin. To aid sleep, the standard dosage ranges from 1 to 10 milligrams per day. However, the optimal dose has not been formally established. Since not all melatonin supplements are the same, make sure to follow the instructions on the label. Also, keep in mind that the quality of over-the-counter supplements is not monitored by health authorities. Try to choose brands that are reputable and certified by a third party, such as Informed Choice or NSF International. Although many experts support the use of melatonin supplements for children and adolescents, they do not recommend it until more studies are conducted. Since melatonin is transferred into breast milk, people who are breastfeeding should keep in mind that it might cause excessive daytime sleepiness in nursing infants. How to increase melatonin levels naturally? You can increase your melatonin levels without supplementing. A few hours before bedtime, dim all lights at home and avoid watching TV and using your computer or smartphone. Too much artificial light can reduce the production of melatonin in your brain, making it harder for you to fall asleep. Getting enough natural light can also help boost your sleep-wake cycle. It can help you fall asleep faster and wake up feeling refreshed. Other factors that have been associated with lower natural melatonin levels are stress and shift work. The bottom line: melatonin supplements haven't been linked to any serious side effects, even at very high doses. However, most experts agree that more research on melatonin's long-term safety is needed. Therefore, sensitive individuals, such as children and those who are pregnant or breastfeeding, should consult a healthcare professional before taking it. Despite the concerns about its safety, melatonin is still considered to be an effective sleep aid. It can help you fall asleep faster and wake up feeling refreshed.